Myocardium, the fancy name we use in scientific term, which means heart. Being one of the most active organ in our body, it keeps working 24/7 now to keep us healthy. But due to our poor eating habits, lifestyle, pollutions, and genetics, we are prone to many types of cardiovascular diseases nowadays. And among these, some can be treated through some medications or therapies, but for some, the surgery is the only option. And among all the type of cardiovascular surgeries, the most complicated one is the open heart surgery. Now imagine your heart beating out of your body with someone's hand on it that being cut and restructured in order for it to function properly while you are lying on the bed unconsciously. And that's what happens when you undergo the open heart surgery. And after this procedure is done, the cut that were made during the surgery is closed back through a suturing process. Now bear with me, the trauma doesn't end there. It follows you after the surgery through some complications, where some patients may experience bleeding after the surgery. Some may have to stay in the hospital until they fully recover. Some they have infection at the cuts that were made during the surgery, or some they have to be in respiratory support for a longer period. And among all the type of complications, the most critical to be diagnosed and treated is the bleeding that comes after the surgery. Now you may wonder, how can a heart bleed when it's already covered with blood? There are two possible reasons for this bleeding to occur. First is due to the surgical error, where the surgeon might unnotice a cut that was made during the surgery, or the suturing get loosened that results of the leaking of the blood from that region. And secondly is due to the non-surgical reason, where the patient itself has a medical history with bleeding or blood coagulation. So generally, what we see from this video is when we cut a finger, the blood leaks out of the cut, so we immediately put a plaster to prevent further bleeding. And within few minutes, the bleeding stops, and within few days, the cut returns to normal condition like nothing happened. And that's where the blood protein and plasma comes in rescue to stop the bleeding, to seal the cut, and at the same time remodel the skin in order to return back to the normal condition. This is what we see when it happens to our skin. But how do we address this when it's happened to our heart? Do you know that there are some cases where the patients are rushed back to the operation theater again after the surgery due to the bleeding complications from the heart? As a Malaysian, I don't think we need this kind of buy one free one option in such a life-threatening situation. But unfortunately, it's happening. And currently, a cloth-like material is being used to be applied on the surface after this surgery. But the problem with this material is that it has a very large porosity. So when the blood leaks, the blood even leaks out of the material due to the large porosity, and it doesn't have any blood coagulation agent to stop the bleeding. And because of that, the patient still has to undergo some blood therapies and might prescribe to high-dose medications. So to address this problem, currently I'm coming up with in a simpler word, a plastic-like membrane with blood coagulation agent on it to address this heart bleeding problem. I am RATHOSIVAN GOPAL, currently a PhD student in Biomedical Engineering at University of Technology, Malaysia. Allow me to briefly walk you through my current research work. So this plastic-like membrane contains of three main components. The first component is called polycaprolactone, or PCL in short, is the base layer for this membrane. And the second component is called polydopamine, or PDA. It is an adhesive layer to attach the third component, which is the factor 7. It is a type of blood coagulation protein. So by stacking these three components by layer, we formed a three-layered membrane as illustrated here, as theoretically. And this membrane will be attached onto the heart surface where the cuts were made during the surgery. And that's what we call the heart plaster or cardiac patch. It seals the region while preventing it from bleeding. So let's see, what is this factor 7? So imagine this factor 7 as our very own Agent 007. It does what our James Bond do best. Save our life, but just in a different way. This factor 7 is the main coagulation protein that comes in rescue when we are injured or cut our skin to stop the bleeding. And without this factor 7, the bleeding can be a severe blood loss. And because of its function, this factor 7 is being used as a homeostatic drug and therapeutic option to treat severe bleeding cases, and it has shown positive results. But the problem with factor 7 that it has a very short half-life, and because of that, the patient have to frequently uptake this factor 7. And to address this problem as well, this factor 7 will be attached onto this PCL membrane with the help of PDA layer. And after this membrane is fabricated, it will be studied in terms of its surface properties and also biocompatibility for an implant material. So first we look at why this component has a three main component. The first component, as mentioned earlier, is called polycaprolactone or PCL. It is a type of polymer that being used in the medical field as an implant material or as a drug delivery vehicle for decades. But the problem with this PCL is it is an inert material, which means it doesn't have any active component on its surface for other molecules to attach to it. And because of that, we use the second component, which is called polydopamine or PDA. This PDA is a type of biopolymer that can form a layer on any type of surface. At the same time, it can create a platform for other molecules to attach to it as well. So by having these two components, the third component, which is the factor 7, can be attached to this membrane through a three simple step fabrication process. So first, this PCL will be fabricated through a casting method, and then this plastic-like PCL will be immersed into the PDA solution to form the PDA layer, and then these membranes will be immersed into the factor 7 solution for the factor 7 to attach to the PDA layer. And this membrane will be studied in three parts, where the first part is on to study the surface characterization, and second part is to study the effect of this membrane towards human skin cell, and third is towards the human blood cells. So I've been saying this plastic-like membrane for quite a long time, so let's look how this plastic-like membrane really looks. So the first image here is the PCL membrane that looks and texturally feels like the plastic. And by comparing the second and first image, we can see the color change at the second membrane due to the PDA layer formation. And by comparing the third and second layer, we couldn't observe any direct physical changes because of the small size of the factor 7. And to prove that, we have to do further surface characterization analysis. And for that, first we did a high-resolution scanning electron microscope to observe the membranes in a micro scale. And by looking at these high magnification images, we can see there are some clear differences between all the three membranes. And in terms of its roughness, we studied this membrane through another analysis called atomic force microscopy. And we obtained the surface roughness to be with the increasing layer of the components onto this PCL layer. And further, at the same time, we study the water contact angle of this membrane to understand how well this membrane likes water, and we observe that the contact angle decreases with the increasing layer onto the PCL membrane. This means that the hydrophilicity of these membranes are increasing. And especially for an implant material, surface roughness and hydrophilicity are two main parameters for an implant to attract more cells attached to it to speed up the healing process. And with this analysis, we can find that it is a good indicative that the surface properties of this PCL membrane, especially with factor 7 on it, has a good improved roughness and hydrophilicity that can be used as an implant material. But logically, when we look at the third image, we will think that particles or the granules we see are related to factor 7. But to confirm that it is not a dust or any other particle and it is a factor 7, we did a chemical characterization. And for that, first we did a simple infrared spectroscopy to study the surface chemical bonds present on the surface. And by comparing, we found that the original properties of the PCL and PDA are preserved and there is no foreign bonding observed between these three samples. But Due to the low concentration of the factor 7, it is quite difficult to distinguish the presence of factor 7 through FTIR. And for that, we use a highly sensitive spectroscopy, which is called X-ray photoelectron spectroscopy. And from these peaks, we can see that there is a tiny little peak at the top right, which corresponds to sulfur. And among all the type of all the materials that used in the fabrication process, only sulfur has a only factor 7 has a sulfur-containing amino acid group. And by comparing all this again and looking back all the images that we saw earlier, we can confirm that the particles we saw earlier correspond to the factor 7, and it has been successfully attached to the cell membrane. So now we move on to studying the cell properties of this membrane. So first we did a toxic study of these membranes when it's exposed to the human skin cell. And we found that these PCL membranes were categorized into a non-toxic biomaterial due to the cell viability percentage of more than 75%. And with factor 7, it reached almost up to 100%. This means that these materials are really cell-friendly and it doesn't kill the cell. So we further studied it using a human blood cell. And from this, we categorize these membranes to be non-hemolytic due to the hemolytic percentage of less than 2%, which means that these membranes does not cause the red blood cell to burst and maintain the normal function of the red blood cell. So when these membranes exposed to blood cell, the original property of red blood cells does not be affected due to this foreign material, and the cells can accommodate well the presence of this membrane. So it also proved that these membranes are blood friendly as well. So we proceed further to study the main function of our agent 007, which is to form clot. For that, we use a clot formation time analysis. And from this, a typical coagulating material should form a clot within less than 35 seconds. But when we look at the membrane with factor 7 on it, it almost recorded up to 60 seconds of clot formation time. And when we think about what this happens, we come up with a reason because of the strong bonding between the PDA and factor 7 causes a slow release of the factor 7 to the solution or the blood to able to initiate the coagulation process. And when we look back our aim, we want to prolong the effect of the factor 7 when it's implanted, and by looking at this result, we can confirm that this effect has been prolonged when it will be implanted into the human body. So one of the goals is being achieved by looking at this analysis. And further, we observed the bloods that we tested using this membrane under the microscope, and we noticed some interesting results from the images. So what you see here is the blood images of 5,000 times zoomed in image from what we normally see. And what's more interesting here is the image at the bottom right, where the blood cells shapes are really weird, which is called like polyhedrocyte. And this is what normally happens in our body when our blood starts to coagulate. It changes into the shape of polyhydrocyte in order for them to tightly pack together to form clot to seal the cut and prevent bleeding from the cut. And this also clearly shows a good evidence that this material with factor 7 and PCL has potential to be used as a membrane that can be applied on the heart surface to seal and at the same time to stop the bleeding. So now imagine this as James Bond going for a gunfight without wearing a bulletproof vest. No matter how good he is, it only takes a single shot to make things complicated for his life. And similarly, even when you go through a traumatic experience with an open heart surgery, it only takes few leaking bloods for you to be rushed back to the operation theater again for the secondary surgery. But this can be prevented by applying this membrane onto the heart surface. While you're recovering, this membrane will do its work, protecting your heart and stop from bleeding. So by saying that, now I hope you are ready to clearly understand my research topic, which is titled Immobilization of Factor 7 through polydopamine grafting on polycaprolactone membrane for cardiac bleeding application. So by saying that, I thank you for listening to my presentation today. And remember, a good pumping heart is always better than a leaking one. Thank you.
Thank you, Rato, for the very nice presentation. Rato, do you make all the animation yourself?
Yeah, I do. It took a long time.
That's very interesting. Okay, now we would like to invite the panel of judges for questions to Rato.
Thank you, Rato. A very good graphical presentation it was, and I was like, when I go through, I was like a member of the Bond Club, and then suddenly you come up with the agent because it's factor 7, and then it's agent, double agent, and at the end, when you come with the last graphical presentation saying about that, yes, it wrap it up. Okay, so I invite Prof. Maria. You look anxious to
Thank you, Rathos. Very, very interesting. I'm actually looking forward to ask you. Several questions. But anyway, I love the way you use that analogy, James Bond thing. To summarize everything, and it's very good. It seems that everybody can engage to what you're trying to deliver here. Just that very simple question for me. Since you developed this this membrane, right? Do you think what are the other potential application beside as a heart plaster?
Yeah, thanks for that. This
because it has significant characterization, right? So I just want to know your opinion in this.
Okay, as because why it's focused on heart here is because the heart is like a very active muscle, so it keeps pumping, and the contraction and expansion of the heart muscles is really active. So when we put an implant or any type of material on the heart, we need to accommodate the mechanical properties or the movement of the heart so that the material doesn't fail. So that's why we focus specifically on the heart for this membrane to come this membrane, and we will modify the mechanical properties in order to accommodate the movement of the heart. But at the same time, this membrane also can be used in any other, it can be also applied on our skin, because the factor 7 is main responsible is just to initiate coagulation, and it's nothing more too specific for that. So it can be applied in any places, any wound. Just the mechanical properties and also the specific properties of the targeted region needs to achieve in order to apply this membrane so that it doesn't fail very easily. So that's why it's like only focus on heart for now. Yeah, but it can be versatile membrane as well because of the function. Yeah.
Thank you.
Thank you, Prof.
All right. Hisham.
Okay. Good morning, RATHOSIVAN. Okay, it's interesting topic to discuss, especially looking into moving forward and how we actually look into some of the material of the future to actually look into compatibility to replace existing. Can you actually share with us in terms of how feasible is manufacturing of this membrane to make it feasible and also marketable for normal use, and also to make it cost effective?
Okay. That is a good question. Where it is this research still haven't reached to that part yet. Okay, and theoretically, what we plan for this material is to be like a two-layered material. So the outer layer will focusing on stop the bleeding. The inner layer will be like to attaching on the heart surface with some mucoadhesive properties so that it can adhere to the heart surface. So, but to be applied on to be mass produced, this membrane is aiming to be a low cost production, because normally as comparison in market currently they be using the electron spinning method to come up with the fibers to be applied onto the heart surface to as be used as a sealant. But with the electrospinning, it is a high energy and also causing more time to be fabricated as compared to this method where this PCR, the polymer, will be only diluted or dissolved into the solvent, and then it will be evaporated until it forms a thin membrane. So it's a really simple fabrication method that can save cost at the same time, and it can save more time to be produced as compared to currently available method that being used as a cardiac plaster.
Okay, thank you, RATHOSIVAN.
Right. Last but not least, our Dr. Azmi.
My question is simple. At what stage has this study reached? Has it been tested on animal?
Not yet, sir. It's still in the early stage of we trying to manipulate the parameters to apply applicable to hard surface, because there's still some of the parameters like the mechanical properties or the amount of the factor 7 that can be attached onto this membrane, and the size. It's still being manipulated to optimize the suitable values so that we can proceed to the further animal testing and other designing process. So still in the early stage of optimization.
Alright. Thank you.
All right. Thank you to Rato and also to all the judges. With that, from electrical and then plastic and then biomedicals, we have a very good, good progress on sharing the advancement in materials. And I proceed this to our Miss Wong. Miss Wong.
Okay. Thank you to the panel of the judges, and thank you, Rato. So the long-awaited moment has finally arrived. I'm going to pass the stage to Dr. Andrew Ng Kailap, Chairperson of MLC 2022, and Dr. Noor Akmal Fadil, Chairperson of MLC Committee Institute of Materials Malaysia IMM. Dr. Andrew and Dr. Noor Akmal will announce the winners of National MLC 2022.
Right, awesome. All right, so this is my first time appearing in the final, okay, but I think all of you have seen me before in the semi-final. So once again, time flies, so we have come to the end of the final round for the material selection competition. So I would like to thank everyone for your participation, the judges, the participants, and even all the audiences, whether you are on the streaming page and you are still with us, good. All right, so yeah. And now we would like to proceed with the announcement of the winners. So do take note that actually we have the top 5 finalists for today. So everyone, regardless of your position, you will still get a prize home, all right? No one will go back home empty-handed today, all right? The only question is how much money will you be getting, all right? That's the question, all right? So we have 2 consolation prize at the price of 500 Malaysian ringgit. Then we have the third place, second place, and the first place. So the first place will be getting the 3,000 ringgit. Then the second place will be getting the 2,000 ringgit. And the third place will be getting the 1,000 Malaysian ringgit. All right. And then also on top of that, the champion of the materials lecture competition would then be representing Malaysia for the Young Persons World Lecture Competition in the Q4 of 2022. All right. So that one will be updated by IOM3 UK. And now we are waiting for the final moment. All right. So who will be the champion for materials lecture competition? So put your hands together. The champion for materials lecture competition for the year 2022 would be from University Teknologi Malaysia. The finalist name would be RATHOSIVAN GOPAL. All right. So once again, congratulations to Rato.